My name is Dr. Larry Nichter, and today I wanted to spend just a few minutes on telling you about the dangers of smoking, actually the dangers of any type of nicotine product. The reason I want to spend this time is that my personal feeling is that although less than 20% of my patients smoke, more than 80% of the complications I've seen through my career have been in smokers. And that's why it's so important to stop if you possibly can. First, I just want to tell you why smoking is so dangerous. And I'm not talking about heart disease or lung disease or premature aging of the skin, which smoking certainly does, but I want to tell you why it's dangerous for the surgery that you're about to undertake. So smoking, it's not just nicotine, which is a really significant drug that can cause problems, but also hydrogen cyanide and carbon monoxide, and all three restrict blood flow to your tissues. And after all, it's the blood flow that allows you to heal in a fast, predictable manner without complications. So let's talk about nicotine, which is the major component. And to a plastic surgeon, whether you've stopped smoking but are taking nicotine in other forms, it's all the same risk. So whether it's in the form of nicotine gum or lozenges or patches or other forms, they're all equally bad. Nicotine itself vasoconstricts blood vessels. And what the word vasoconstriction means is it clamps down on blood vessels, and it significantly restricts blood flow, especially the tiny microscopic blood flow channels at the skin level. And that's where most of the healing takes place, especially with lifts and so on. I'm going to give you 3 examples of how the complication rate is grossly exaggerated and accelerated in patients who smoke. One study in the plastic surgical literature looked at more than 130 plastic surgery patients that underwent tummy tuck procedures, also called abdominoplasty. They noted that there was, between minor and even some not so minor problems, a complication rate of approximately 12% in non-smokers. But in smokers, this was nearly 50%. Another study looked at complications, specifically the potential for skin loss because of decreased blood flow following facelift procedures. And they found there was more than 12 times, that is 12 times the incidence of potential loss of skin, or what's called skin sloughing, from inadequate blood in smokers versus non-smokers. Lastly, I just want to mention, even for breast augmentations in young patients, the risk of capsular contracture, that is hardening of the implants, that can also distort the implants as well as even cause discomfort, is more than 10 times the incidence. In one study, they even thought it may be as much as 30 times the incidence of developing a capsular contracture. So if you were going to stop nicotine products, this is certainly the time. We spoke about blood supply to the small tissues, but there are also some other risks that are involved. The potential to develop postoperative pneumonia, bronchitis, and these infections, by the way, can spread to your surgical site as well, are also very significant. If you're undergoing a procedure that's a long one, it greatly increases your risk of getting into problems in additional areas such as blood clots in your legs, which can even travel to your lungs. The question arises how long you have to stop smoking to decrease your risk markedly. There's actually a study that answered that. In the Archives of Internal Medicine, a study was done, and they found that if you stop smoking, and that means all forms of nicotine, it even means secondary smoke, for more than 8 weeks, that your risk almost decreased to someone who is a non-smoker. Again, this doesn't mean you can pick up a cigarette right after surgery, because healing takes place over several weeks to months. And if you have an implant, such as a breast implant, the risk of becoming hard increases dramatically at any time in the future when you smoke. So I'm not an expert in how to stop smoking. Smoking is one of the most addictive medications or drug forms available, but I suggest you speak with your family physician about this. Some people are successful by acupuncture or hypnotherapy. There's certain medications in the Wellbutrin family and antidepressant families that may be helpful. And there's also a new medication which I strongly urge you to speak with your family physician called Chantix. And that's a medication where they've actually discovered a way to block the nicotine receptors of your brain so that you no longer have the urge to smoke. In fact, you just simply take the medicine and apparently there's no desire to smoke and it slowly decreases. But I urge you to see your family physician to try to find a way of doing this successfully. I hope this information was helpful to you, and I wish you a speedy recovery following your surgery. Thank you.